Alrighty. This is Angelica, Nikki, and Grace's final presentation for systems behavioral neuroscience, and our topic of choice was generalized anxiety disorder. So, generalized anxiety disorder is characterized by chronic and persistent worry. The body demonstrates a disproportionate response to stressors, and it's typically treated by some combination of psychotherapy and medication.
So the major types of anxiety disorder are panic disorder, generalized anxiety disorder, specific phobia, social anxiety disorder, and agoraphobia. Panic disorder is characterized by repeated panic attacks, generalized anxiety disorder with persistent anxiety, phobia with the persistent fear of objects or situations, social anxiety is the fear of social interactions, and agoraphobia with the fear of public places. The disorder with the highest prevalence of 12.5% is phobia, and the disorder with the lowest prevalence at 2% is agoraphobia. Generalized anxiety disorder with a prevalence of 5.7% is what we'll be presenting on. GAD is diagnosed about twice as often among women as men, and about 3% of adults are affected by GAD in a given year. Symptoms are both psychological and physical. Psychological symptoms include excessive worry, distress, uneasiness, fear, apprehension, and overthinking. And the physical symptoms are tachycardia, which is increased heart rate, dyspnea, which is difficulty breathing, sweating, dizziness, trouble sleeping, shaking, and muscle tension. To better understand these symptoms, I'm going to use the Brooklyn subway shooting as an example scenario of how people with GAD may react. Someone with generalized anxiety disorder will be very apprehensive to travel on the subway again due to the fear of it happening again when they are on the train. They'll be overwhelmed by the idea of taking the subway again, which may cause them to take other forms of transportation, such as the bus or car. They will be consistently overthinking about the scenario and may have intrusive thoughts about it happening again when a loved one or coworker is on a train. Their inability to relax due to these persistent worries is paired with an increased heart rate and uneasy stomach. They may be consumed with these intrusive thoughts that it keeps them up worrying about it at night. Other physical manifestations due to their anxiety include frequent urination and body ache. As outlined by the DSM-5, generalized anxiety disorder is characterized by excessive anxiety and worry about various activities such as school and work persistently for at least 6 months. This 6-month period is the time frame required for symptoms as well. At least 3 of the following symptoms must be present for diagnosis: restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Day-to-day functioning is impaired due to psychological and physical symptoms such as social and occupational functioning. GAD is not the physiological effect of a substance, medical condition, or another medical disorder.
Generalized anxiety disorder can be genetically predisposed or brought upon by environmental factors. Some genetic factors include the serotonin transporter SLC6A4 region. It has a shorter allele and is normally a less active gene. However, in patients with generalized anxiety disorder, the transporter has been shown to be significantly more active. Additionally, the monoamine oxidase A, which is a longer allele, was also seen to have higher activity in adolescents with generalized anxiety disorder than their peers without generalized anxiety disorder. In general, those with generalized anxiety disorder demonstrate higher levels of DNA methylation and a high amount of DNA being expressed. Some of the environmental factors, such as stress and a history of abuse, can lead to generalized anxiety disorder. The history of abuse can be a cause for generalized anxiety disorder because an environment such as an abusive one can cause hyperarousal, and this is likely to result in the inappropriate response to stress that we have classified as generalized anxiety disorder. Generalized anxiety disorder, as we have expressed, is an inappropriate response to stress caused by either a stressor not being there, or it's not supposed to be a stressful stressor. It can be a neutral phase or something like that. So when there is supposed to be a normal response to stress, this occurs and starts in the brain, in the hypothalamus. It releases corticotropin releasing hormone, which stimulates the anterior pituitary gland to release adrenocorticotropic hormone. This hormone goes to the adrenal gland on the kidney, and that gland releases cortisol, which elicits the flight or fight response in our bodies. In studies with generalized anxiety disorder in the brain, the anterior cingulate cortex, which focuses on conflict monitoring and fear learning, has been shown to be less active in the frontal portion of the anterior cingulate cortex when viewing non-fearful faces. During an emotionally conflicting task, the anterior cingulate cortex has more activation and less functional connection with the prefrontal cortex, which is in the area in between those two pink lines. The insula has shown to play a role in generalized anxiety disorder. The insula is useful when effectively understanding what stimuli are being seen and the body processing. When shown pictures of stimuli such as snakes and spiders, anxiety-prone individuals have more bilateral insula activation than controls, which reduces activation of the frontal gyrus areas. Differences in the way anticipation is processed is also linked to the right amygdala, and children with generalized anxiety disorder have hyperactivity in their right amygdala when shown negative images. This fMRI image was taken when pictures of neutral faces were paired with an unpleasantly loud tone. This stimulus spiked the brain regions of the anterior cingulate cortex and the anterior insula, and these two areas are now part of what is known as the fear network. This is just another fMRI showing that people with generalized anxiety disorder show significantly less gray matter in the supramarginal or postcentral cortex gyrus. Patients with generalized anxiety disorder have been shown to exist at a heightened baseline of arousal compared to controls, such as having a higher heart rate, which can be tied to patients of generalized anxiety disorder having fewer GABA receptors. This causes them to be more likely to demonstrate the greatest amount of cardiovascular activity when trying to relax or view a neutral stimulus that should not produce a lot of cardiovascular activity. Because of this higher starting baseline, which is unique to generalized anxiety disorder versus other anxiety disorders, anxious thoughts are present even in the absence of a threat. The chronic stress leads to excitotoxicity and a smaller hippocampus. When the hippocampus is smaller, the inhibition of the HPA axis is not as efficient, and certain drugs target this system in an attempt to help generalized anxiety disorder, which will be explained in further detail later.
When diagnosing generalized anxiety disorder, the primary measure used is the GAD-7. This is a 7-question measure where participants are asked to score their experience with a level of 0 to 3, 0 being not at all, or 3 as often as nearly every day. The maximum score for this measure is 21. Scores of 10 and above are considered moderate to severe anxiety and require a follow-up interview with a clinician. In regards to treatment and prognosis, several treatments have been shown effective. For the sake of our presentation, we'll be focusing on anxiolytic medications, meaning anti-anxiety medicines, and psychotherapy and self-regulation techniques. It has been found through meta-analysis that patients do tend to prefer psychotherapy, but that ultimately a combination of these two treatments is the most effective. In regards to prognosis, through proper treatment, people have good outcomes and symptoms are lowered and their ability to cope with stressors is usually heightened. When discussing anxiolytic medications, it is important to understand that GABA is the major inhibitory neurotransmitter in the brain. Therefore, by regulating GABA, we can increase inhibitory activity in the brain and limit stress response and lower our feelings of anxiety. Benzodiazepines, one of these anxiolytic medications, bind to and potentiate GABA receptors. The unfortunate truth with benzodiazepines is that they come with a high risk of negative side effects. Examples of these include reduced psychomotor activity, risk of interaction with other drugs such as alcohol, and a development of dependence on the benzodiazepines themselves. Therefore, they're not intended for long-term use, but can be successful in emergency situations. More commonly, serotonin selective reuptake inhibitors are prescribed to people struggling with a generalized anxiety disorder. SSRIs do require time for high efficacy because they result in long-term adaptations of the brain. It is believed that they enhance neurogenesis in the hippocampus by affecting the HPA feedback loop and inhibiting cortisol. As mentioned previously, benzodiazepines help to potentiate GABA receptors or keep them open longer. So the benzodiazepines, as well as things like ethanol, neurosteroids, and GABA itself, bind to GABA receptors, and in the case of benzodiazepines, they keep them open longer so that more chlorine can flow into the cell and reduce feelings of anxiety or increase calmness, however you choose to look at it. In regards to the SSRIs, it's important to understand the HPA axis and the push-pull regulation of it. So this system is acted on by SSRIs. The amygdala projects onto the hypothalamus, which activates the HPA axis. At the same time, the hippocampus is working to deactivate the HPA axis, hence the push-pull regulation. This demonstrates that the actual presence of cortisol ultimately regulates and inhibits its own release. SSRIs are believed to increase the neurogenesis in the hippocampus and the number of glucocorticoid receptors where cortisol itself binds. In the long term, cortisol inhibition reduces symptoms of anxiety. In terms of psychotherapy and relaxation techniques, we're going to focus on cognitive behavioral therapy and mindfulness techniques. So CBT involves a limited number of structured talk therapy sessions where a clinician works with the patient to identify and address patterns of often negative thinking. Mindfulness techniques place an emphasis on the present moment, may involve meditation, and help the client to relax and reduce their stress. So on this slide, I'm showing an example of a mindfulness technique, which is as simple as focusing on your breathing and allowing yourself to calm down, see and accept things as they are, place a purposeful attention on this moment, and hopefully reduce any anxiety you may be experiencing.
So the recent literature we chose, we definitely want to focus on the pandemic. So we felt it was important to note that the recent literature appears to suggest that the ongoing pandemic has likely increased incidence of generalized anxiety disorder and other anxiety disorders, especially among healthcare workers. Symptoms of GAD were identified in 4 out of 10 Colombian doctors during the beginning of the pandemic, which was March 24th to the 30th of 2020. These results were cultivated by having doctors fill out a form containing the GAD-7, which was mentioned earlier, demographic information, and the fear of COVID-19 scale. They found that the following psychosocial and demographic factors led to an increased risk of GAD: female gender, discrimination, stress, and fear of the pandemic. Since anxiety is closely related to psychological stress and work-related stress, it is clear why so many doctors appear to have symptoms of GAD. The study found that that COVID-19 fear symptoms were more frequent and associated with symptoms of generalized anxiety disorder. And these are our references. Thank you.